Hi, Internet. Another thing I wanted to say on disorder, which is just the gift that keeps giving, really, isn't it? It's so complicated and thorny and barbed with the potential to upset and offend. I'm nervous approaching it a little bit, but I'm still going to do it because I'm brave and scared and contradictory. So you've got trauma and you've got disorder. And the dysfunction is the cause of that supposed dysfunction more an in-deep scientific genetic passed down disorder that your dad, your granddad had, or is it rooted in trauma, difficult childhood stuff, and multi-generational trauma that your dad and granddad also had as well? And wherein lies the difference between trauma and disorder? And are you better off going down the diagnosis route, getting diagnosed as having a condition and then getting medication for it, which might be transformative, it might be revolutionary, it might be really powerful and undeniably a good thing which helps you to function better? Or is it more rooted in trauma that it would be better to look at and get a better understanding of and enable you to join the dots of the parts of your childhood that maybe weren't ideal and made you how you are, and also made your dad who they were and your granddad who they were? Having that understanding and awareness can help you not pass it on to your kids, maybe, right? And having that understanding is itself powerful too. But what direction you go down, that's hard and that's difficult. And that's for you to decide, I suppose, where on that big spectrum your dysfunction lies. How debilitating and inhibiting is it to your life, to your feelings, your emotions, your relationships? Is it something that you could look at, but it would be extremely painful and hard and difficult? Or is it something that's easier to kind of medicalize perhaps and think, I just want someone to quieten all that noise in my head that just makes it so hard for me to function in what I think is the most reasonable, best performing way? That's a really hard goal. But the knee jerk and the instinct, and I suppose my discomfort, is that it feels easier for people to go down that latter route of medicalising it because it almost offers a level of permission and it's kind of a little bit more convenient. Is it kind of going to have that long-term impact, or is it just a kind of a temporary fix? Same could be leveled as psychotherapy. Any sort of therapy, is that a temporary fix as well? All this stuff, I'm really sorry, there's not kind of super simple, easy answers to any of it, but it is all worth considering and weighing up against each other. That's what I think.